Hello and welcome. I'm so glad you're here. If you found your way to this explainer, you're probably looking for some clear, gentle guidance on your recovery. And you've come to exactly the right place. We're going to walk through this together, nice and easy. So let's get right to it. The big question on so many women's minds is this one right here. It's such an important question, and you are definitely not alone in asking it. The wonderful news is, there are safe, clear ways to weave your therapies back in as your body heals. And that's exactly what we're going to explore. Okay, so first things first, let's talk about the timeline. The most important thing to remember is that your body is incredibly wise. Healing isn't a race, it's a rhythm, and our goal is just to listen to that rhythm and support what your body is already doing so beautifully. And this is where it's all about finding that sweet spot, It's this delicate dance between healing and making progress. If you push too much, too soon, you can actually set yourself back. But if you pause for too long, things can start to tighten up. So we're looking for that gentle, gradual path forward, with your body leading the way. Think of this as a gentle roadmap for your recovery. In those first few days, it is all about rest. Seriously, no internal therapy, just rest. Then, as your body starts its early repair work, you might be able to begin some gentle external exercises, but only if your doctor gives you the green light. Then, usually around weeks 2 to 4, you can start to gradually reintroduce internal therapy, leading to a full return to your plan over the next couple of months. And please, please remember, this is just a guide, not a strict deadline. Your journey is yours. Okay, so that's the big picture. Now, how does this actually work day to day? How do you apply this timeline to your dilator use or your physiotherapy? Let's break down the practical steps. When it comes to your dilators, the key word here is gentle. First, you're going to take a complete break for at least a few days. And when you do start again, and this is so important, you'll likely want to begin with a smaller size than you were using before. That just takes the pressure off. From there, it's all about slow and steady progress. Always letting your comfort be your guide. Pain is just a signal from your body to ease up a bit. Now, this is a really crucial point, so let's spend a moment here. Why you're using dilators completely changes the approach. If you're using them for something like vaginismus or pelvic pain, any sharp discomfort is your body saying, hey, let's take a little break. A few days off can do wonders. But, and this is a big but, if you're using them after radiotherapy or surgery, it's a totally different story. In that case, pausing can actually risk permanent changes, so it is absolutely critical to stick with the plan your oncology team gave you. And what about your physiotherapy? Well, your physio is an expert at adapting your care. You can keep doing things like deep breathing exercises right away. But for any internal work, you'll probably wait a week or two. The most important thing here is teamwork. You want to make sure your physio and your doctor are talking to each other and are on the same page with your care plan. Okay, let's talk about something called red flags. I know that term can sound a little scary, but I want you to think of them differently. These aren't alarms. They're just important messages from your body telling you it's time to pause everything and give your clinical team a call. They're helpful signals. So here are a few of those signals your body might send. We're talking about bleeding that's more than just a tiny bit of spotting, or pain that's getting worse instead of better, any unusual discharge or odor, or sudden new muscle spasms. Those are your cues. It's rare for these to happen, but knowing what to look for empowers you to do the right thing. Stop and make that call. You might be wondering where all of this gentle, patient-first guidance comes from. Well, it's shaped by the incredible philosophy of Dr. Farzana at the Women's Health Clinic, a true expert who's dedicated her life to women's healthcare. And really, her own words say it all. It's not about being told what to do. It's about understanding what's happening in your body, setting realistic goals together, and making decisions as a team. You are a partner in your own care. And just look at this number, 20+ years. That's more than 2 decades of dedicated experience focused entirely on women's health. That is an incredible amount of wisdom and expertise behind every piece of advice. And these aren't just letters after her name, they tell a story of deep commitment. From her medical degree to her specialist training, she's an expert in complex conditions. And what I think is so amazing is that she also trains other doctors, sharing her knowledge to raise the standard of care for women everywhere. So we've covered the timeline, the therapies, and the philosophy of care. Now let's bring it all back home, to you. What are some simple, empowering things you can do right now to nurture your body as it heals? Here are just a few really simple, lovely things you can do for yourself. Deep belly breathing can work wonders for releasing tension. A warm compress can feel so soothing. Of course, nourishing your body with plenty of water and good food gives it the building blocks it needs to repair. And maybe try journaling. It's a beautiful way to see just how far you've come on your journey. I really want you to hear this and let it sink in. We've laid out a map today, but your journey is completely, beautifully, and uniquely yours. There is no one right way to do this, and you are the #1 expert on your own body. And if there is one thing, just one thing, you take away from our time together, please let it be this. This information is here to help you feel informed and empowered, but it is not a substitute for the personalized advice from your own doctor or physio. They know you, they know your history, and their guidance is what matters most. So I will leave you with this gentle question to think about. After all of this, what is one small, kind thing you can do for yourself today? Whatever it is, I hope you do it. Know that you are on the right path, and every little step you take is a win. Be so gentle with yourself.